Welcome to Vids Made Simple. This video is about Lennox Gastaut syndrome. If you're new to my channel, I'd highly recommend you to hit the subscribe button and the bell icon next to it so that you can watch all my previous videos and my upcoming videos, and it's totally free of cost. Lennox Gastaut syndrome is a syndrome which is characterized by seizures, and the seizures in this syndrome is usually mixed seizures, which means various combinations of seizures can occur in these patients. It can be tonic seizures, atonic seizures, myoclonic seizures, atypical absence seizures, and even generalized tonic-clonic seizures. This can be diagnosed with the help of electroencephalography, in that we have a classical description of the pattern, which is known as generalized slow spike and sharp wave pattern of 1.5 to 2.5 Hz. Now, you need not know much about the electroencephalography in detail because that is beyond the scope of this video, and we need not know much about electroencephalography. And if you're interested, you can read much about it, but you need to know the pattern of the electroencephalography in Lennox Gastaut syndrome, which is classically described as generalized slow spike and sharp wave pattern of 1.5 to 2.5 Hz. Now, it is one of those epilepsy syndromes which is difficult to treat, although it can be treated with drugs like sodium valproate, lamotrigine, benzodiazepines, topiramate, levetiracetam. There are certain refractory cases which cannot be treated with any medications, so we have to go beyond medications and try some other modalities for treatment in these cases. Some of the modalities which can be tried are dietary therapy. We can try ketogenic diet as well as modified Atkins diet. The ketogenic diet has been used for so many years in epilepsy patients who cannot be successfully treated with medications alone. So what we're doing here is that we are giving highly ketogenic diet in which the fat content will be high and carbohydrate content will be low. So that's the basis of ketogenic diet and modified Atkins diet. In modified Atkins diet, some important points for consideration are the fat content in the modified Atkins diet is very high, and the carbohydrate content is very low in modified Atkins diet. And these patients are also taking highly ketogenic diet. Okay, so there are various clinical trials to compare the efficacy of ketogenic diet and modified Atkins diet, and they have found no clear superiority of modified Atkins diet over the classic ketogenic diet, although many people prefer to prescribe modified Atkins diet for epilepsy patients. Now, this is one of interesting topic to read. Much information on this won't be available in our classic medical textbooks, so I recommend you to read much about this in internet. If you guys want me to make a separate video on this alone, the dietary therapy for epilepsy, I'd be very happy to make. If you want me to make it, please make sure to mention it in the comment section below. And the other option is epilepsy surgery. And in this case, the doctor will try to find out which part of the brain is responsible for the abnormal electrical discharge leading to epilepsy in the patient with the help of electroencephalography and various imaging studies. And if they are able to find out which portion of the brain is responsible for causing seizures in that patient, they'll try to focus on that particular part of the brain, and they can do surgeries, or they can give electrical stimulus, or they can suppress that part of the brain with the help of various techniques. Okay, so they can do any of these to control epilepsy. Now, that is one of the last resort which is tried for seizures, and that has been found to be quite effective in controlling epilepsy in refractory cases which do not respond to normal medications. Now we came to the end of this video. If you like this video, please hit the subscribe button. Also, don't forget to like, share, and comment your suggestions below so that I'll be very happy and excited to make more videos for you guys like this. And if you guys want to support my channel, if you want me to make more videos, you can support my channel by donating on this website mentioned right here, which is www.patreon.com/medvidsmadesimple. And you can also follow me on Instagram at medvidsmadesimple1. That's my user ID. And you can follow me on Facebook at www.facebook.com/medvidsmadesimple. You can check out my blog at www.medvidsmadesimple.blogspot.com, where I'll be sharing some of the tips which you guys personally asked me to give you on studying various subjects and all that. And don't forget to check out our Medvids Made Simple official merch. The link is in the description of this video. And there are certain Amazon links which I've mentioned in the description of this video. If you use that link to buy any products in Amazon, I'll get a uh, part of the amount you pay as commission. So that will also indirectly support my channel. So if you use that link, it'll be indirectly helping my channel as well. So thank you so much for watching this video. Don't forget to like, share, and subscribe to my channel. I'll see you guys in my next video.